And Clay and Iron Show. And by the way, if you look at Nutrimedical, see at the bottom of our associates link, you'll see a link to Clay and Iron, which I've reactivated. You'll see new news items showing up there. On the third hour today, we're going to have Tim Alexander will comment a lot on what Bill was mentioning on his book, Nuclear Showdown in Iran. A couple of announcements. We have Ron Patterson here with LUMEN PHOTON. And the LUMEN, of course, will be one of the therapies available in our now franchising plan. And we've had some contacts already. And I want to re-announce this so people understand what we're planning. We're going to create what I call mobile, if you want to call it, franchises of Nutrimedical. And here's what they'll consist of. Number one, it'll be mobile, either small or large vans. The vans can come to a different part of a city or town or country, anywhere in the world. We're going to franchise it so people will be able to purchase a franchise, and they will have our support because it'll have diagnostic and therapy devices. It will have the ability to have a barista make a specific nutraceutical smoothie or prescribe specific nutraceuticals of our NutriMed line. We'll have the diagnostic machines QRMA, 8D-LRIS, and Metatron with Dr. Nesterov from the Russian Space Agency and the scientists in China, which we'll be visiting in a few weeks to work on the next generation. It'll have the LUMEN PHOTON therapy, micropulse, X-Vitalizer, and other technologies to create a morphogenic field to change your bioplasmatic body. And you can have this done while you're in the chamber, listening to music and relaxing, but also changing your epigenetics and taking the right nutraceuticals to fix your body. It'll also allow diagnostics that will connect with conventional advanced medicine, so we will bump it up to analyze the data and see if you need to see a conventional doctor in your country for specific problems. For example, we'll be able to do genetic analysis, organic acid analysis, draw blood, stir, and stool urine, send them off by FedEx to local national laboratories or international labs. And these mobile vans will be basically anywhere in the world. It can be in South Africa, Russia, China, anywhere on Earth. So this will allow us to have diagnostic therapeutic vans that will have the ability to even draw bloods, urine, stool, do therapy, and then provide nutraceuticals, no drugs, all nutraceuticals, and will also interface with conventional medicines to see if they need to see a surgeon or specialist, or we call an alternative cancer therapy clinic that could be in their country or area of the world. So that's what's coming. And this idea, basically, I got prayer that I think that we will work on all the specific details, and it may be slightly different in each particular territory of the world, but it's going to allow us to have small vans that can actually go up to a person's home or business, and larger ones that will allow multiple treatments inside the actual larger facility. And these will be mobile. So the idea will be they can go to a rural area, provide diagnostics for people to actually reverse their epigenetics, reverse their metabolic and genetic problems, provide the nutraceuticals necessary, and the idea would be to provide a kind of a mobile care that will actually allow us to start fixing a lot of the problems that create illness before they actually become physical pathology. So let's talk about LUMEN PHOTON. This fits in with it because LUMEN is one of the most amazing machines. In fact, I have mine turned on right now, and I'm using it. And this nice thing, I can't wear my micropulse too close to the microphone because a little magnetic pulse will go click, click, click. But the LUMEN is really portable. You can have a little, inverter plugged into your cigarette lighter in your car. You can be using it with a small battery pack in an airplane. LUMEN pads are amazing. I mean, you can treat literally cataracts, traumatic brain injuries, artery, calcification of arteries or aortic valves, chronic back pain, neck pain, peripheral neuropathy, abdominal pain, regenerating, after surgery, you can turn pain off. So literally, if every post-op recovery room had a LUMEN pad, the doctors wouldn't have to give hardly any pain meds, and the patient would be out of recovery and home in no time at all. And I'm sure you have examples of that too, Ron. So let's talk about some of the frequencies used for say, post-op recovery, to everything from balding and people trying to regenerate their hair to stimulating regeneration of knees.
I tell the other persons who are there, I say, use number 7 as much as necessary for pain, and then when the pain situation is under control, and they can usually take another medication, but then we say, keep it simple, use the NICO setting on the healing process, and very often that's all they have to do overnight If they
Right.
keep doing that overnight, they've healed over. I mean, the stitching everything's been, a lot of it has been taken care of.
Right.
Because they're using it a lot. They're usually taking 2 people to just keep it going. But that's worth it.
Yeah. Now, let's go through some of the treatments, because the high frequencies for edit setting number 7 will turn off pain.
Yep.
Some of the settings are stimulating, nerve regeneration, abdominal, or, each particular. It's interesting. It's like a television station. There's a carrier frequency for each of the cell lines, whether it's ectoderm, endoderm, or mesoderm. Let's identify the organs for each of those classes and the frequencies. Can you go through some of those frequencies? So when people get a machine, we use NICO for regenerating, because it's a combination of frequencies. But let's run through some of the frequencies and for different organ systems. Like, let's say liver, kidneys, pancreas. What frequency would you use for
number
helping
4,
those?
that's our number 4 setting.
And what about heart? What about brain? For example, the brain.
4 also is the glandular tissues as well. So
Right.
all the glandular tissues, as opposed to anything else in the body, the glandular tissues are number 4. And number 4 also is incredibly potent at bringing more circulation, more oxygen to the site. So that's a big one right there. That number 4 may be the most important in some of these real chronic situations, some of these
Right.
serious situations.
What about if we're dealing with peripheral neuropathy or chronic back pain? What frequency would you like for that?
Yeah.
You deal with the pain with 7, but if you're trying to heal the joints, let's say you got diabetic peripheral neuropathy.
number 4 again, because we want to increase the circulation, which brings more oxygen into the area. So if it's in the foot, the leg, they'll want to start with probably higher up on the body and make sure that everything's opening up. The lymph systems are functioning and not plugged up or anything.
Good for lymphatic blockage. What about the retinopathy? People, wet or dry macular changes, retinal problems?
Number 3. Primarily number 3. Number 4 also is the secondary there, because that helps. It doesn't take much, but that also, when you're using it over that, it's increasing the circulation throughout the brain. It brings more oxygen into the brain. So
now, one of the things that's neat about this is you can actually do the treatment through a cast. You can do it through your clothing. For example, if somebody has abdominal pain, or they have pelvic pain, let's say they have a painful period or cycle, or they've got chronic colitis, you can actually do treatment right through the actual clothing, or the cast. If they have a cast on, for example.
Right, yeah.
And then what's neat is that you take the cast and say, oh my gosh, did this ever heal well? I mean, and let's say there was, an injury that actually damaged the tissue, so you had to suture it together, and then you had a compounded fracture that you healed and put a cast on. You can put the lumen on, and you'll get remarkable rates of healing. Osteoporosis, osteopenia. We tell people use a Vibra Slim and our bone regenerating pack like Bone Generator, Mycel D3, Myco D2, Full Vitamin K2, Collagen Max, Mountain Red Velvet, Tendon Bender Joint Performance. But when you're using the lumen, you can actually find the DEXA areas of weakness. Let's say L4 vertebrae, right surgical neck and hip, right femur. And you can put it over those areas, and you'll increase the metabolism to increase bone density and strength, because you want to increase collagen regeneration, which is 42% of the dry weight of bone. And you want to not just make bone more dense, you want to make it stronger. And there's a big difference. The DEXA scan only determines bone density, not strength. So when you're using lumen and you take the right nutraceuticals, you're going to increase bone density and strength, just like putting enough rebar in concrete so it doesn't crack when you put a big load over it, say a bridge. And a lot of people aren't aware of that.
That occurs in all this. In the process of helping manage the pain, we're also, people also very often will say, I am feeling better. I'm feeling better. And that's an emotional situation, because it stimulates the body to release endorphins. So
Right.
that helps us get through it, and feel better about it, what we're doing, that sort of thing.
Yeah, and what's interesting, and we talked about this before, if you leave the pads on, you go to the bathroom and you have pets, the pets are going to grab your pads and sit on them because they're so good.
Yeah.
Get a lumen, I'll tell you, you'll be amazed whether or not you're trying to regenerate hair, lower intraocular pressure, recover NICO or cavitations right in your teeth, regenerate bone, stop pain, heal neuropathy, decalcify arteries in your heart or blood vessels or valves. It's amazing. For our next connection, we're going to try to get Bobbi Walton and ALLIMAX. And we also, just before we get there, I want to talk for a few moments about Silver 100. Silver 100 is one of our premier silver products. It is amazing, and it's one of our three big antipathogenics. Top one, NutriMed, then ALLIMED, and then Silver 100. Silver 100 basically is the only ionic silver that literally has a special carrier citrate complex that carries it throughout the body, across biofilms, across cell membranes, across the gut splanchnic circulation to the liver, and all through the general circulation. Because it has this carrier complex, it's not going to inactivate the ionic silver because it's in a stable citrate complex. Therefore, it doesn't get destroyed. For example, when a nanoparticle or colloidal silver particle has a tiny percentage that gets ionized, it immediately interacts with halide compounds like chloride, fluoride, or bromide, or proteins, and becomes bound and inactivated. So you want it to cross those membranes because it has three major actions. First, it's an antipathogenic. It helps your white cells kill by creating superoxide anion radical. It has a direct killing capacity, which is also present. And the third thing it does is it stimulates your stem cells in healing. So that's why it's used in burn units for healing people with bad burns, but it also works throughout the body at activating stem cell activation. So it's a primary activator of stem cell regeneration and tissue healing throughout the body. So when you take Silver 100, if you've had an internal injury of your bowel or brain or any other tissue, Silver 100 not only kills the pathogens and goes through the biofilm, but it also stimulates your body's ability to heal, along with things like Mount Red Velvet, microdose, which is growth hormone, myco-D2, which is ergothioneine, which is a primary stimulant or trigger for stem cell regeneration, etc. So it's quite amazing. Now, Silver 100, because it's a stable citrate complex, it's hundreds of times stronger than any other silver. So a couple of sprays or drops is equivalent to literally glassfuls of any other form of silver, and because you're taking only the ionic state, you don't get overdosed on silver. You just take called the noble metal dosage, which is less than a third of the EPA required silver that should be present in your soil, but the soil has been destroyed using things like soil cleansing technologies or depletion. So the soil doesn't have the requisite amount of silver, which is a noble metal that helps your immune system to clear pathogens and stimulate your body's ability to heal. It's a very important mineral, along with things like zinc and copper, etc. Silver is a biologically important trace element. But when you take any other form, and they'll have all kinds of marketing hoo-ha that is, whether it's they talk about getting silver lungs generator, or they talk about making your own colloidal silver, or buying the silver such and such, oxy and whatever. These are all just marketing ploys. None of them has any active ingredient other than the ionic silver. And if you don't have a citrate complex, when it does get ionized, it interacts with halides or proteins and becomes inactivated. So our silver is hundreds of times stronger. If you take it, for example, in your nose or in your eyes to prevent eye infections, in fact, our eye protocol, we use 2 drops of Silver 100, 1 drop of Can C, Vision Max, a capsule twice a day, Cell Detox Glutathione, and Neurogen, and Omega Supreme Krill, the astaxanthin present, and Nutri-Defense to protect your eye retinal damage. The Neurogen and the fatty acids and Omega Supreme Krill are particularly important for the optic nerve head and the rods and cones area of the eye. And the ellagic acid malignoblock protects the tiny macro vessels in the eye, as well as vein-away diosmin that will protect and stop the Bruch's membrane capillaries from being stimulated by vascular growth factor that it happens to be elevated in insulin that causes fragile capillaries that can rupture. So Silver 100 can be used in the ear. It's so safe and non-toxic and non-irritating. It can be used with drops in the eye. It can be used as a nasal and vertical spray, 2 or 3 sprays 4 times a day, and it helps to eliminate sinus problems. You do inhalation therapy with silver, and it actually knocks out the rhinovirus subclass 3 and other stealth pathogens that trigger off leukotriene D4 and B4 that cause asthma. Silver is pretty amazing stuff in terms of its ability to keep the gut clear, along with using berberstatin, Living Probiotic Ultra. I particularly like silver for clearing the esophagus from things like Helicobacter pylori, and from clearing the lower bowel from anaerobic bacteria that can produce organic acids that can even affect the central nervous system, which you can retest by doing a CDSA2 test at directlabs.com. So silver is amazing stuff. You can spray it on a burn or on an area that's been irritated or burnt, say from sunlight or thermal burn, and you'll see it healing literally within minutes. It turns off the pain and starts the healing process. If you spray it and say on the baby's bottom that has a yeast infection or a diaper rash due to acidic stool, you'll see a dramatic rate of healing that's just pretty amazing. So I tell people Silver 100 has healing properties for stimulating healing, anti-pathogenic properties, and it has properties to turn off inflammatory cytokines that are released by your body's own immune system that can cause local tissue inflammation, even things like thermal injuries or ultraviolet injuries from sunlight. It helps to turn those off. So it's pretty amazing stuff. Now our ALLIMAX, ALLIMED, which we still carry as well, are excellent. They have an anti-pathogenic capacity because the allicin is stabilized with a potato starch that Peter Jostyn, the chemist in Britain, developed. That's what they call pharmacists. They're chemists. And many years ago, and it's been proven by doctors in Britain, they're infectious disease experts, that it will turn off everything from pneumonia to deep sinus infections to deep abdominal infections, diverticulosis, appendicitis, etc. Yeah, it penetrates through the biofilm, so it gets deep into organs. For example, if you've got chronic recurring tonsillitis and cryptitis, you've got chronic otitis media, chronic periodontal disease, it'll actually prevent osteomyelitis of the bone because it penetrates right through the biofilm that ordinary even antibiotics don't penetrate, whereas ALLIMAX, ALLIMED will. And of course we have the ALLIMED, which is basically produces the same allicin, but you get 200 milligrams more of the allicin itself than ALLIMED for considerably less price. But of course we have the proven history of the ALLIMAX and ALLIMED. I tell people if you've got periodontal disease, you've got chronic bowel problems, if you've got any kind of chronic infection of any kind or immune system deficiency, everything from stealth infections in your middle ear that cause vertigo to external otitis media to periodontal disease to dysbiosis in your bowel, we've got overgrowth. The ALLIMAX and ALLIMED will help reverse that. So they're pretty amazing. Another area, of course, that people should be aware of is our VibraSlim. VibraSlim technology, of course, is the exercise, and I call it VibraFit system. I'll describe the technology. I use body elastic bands that are attached to an athletic gymnastic bar above and behind, bolted into the ceiling. So I can use the bands from that. I have the resistance bands on the machine itself. It's a triplanar tri-motion system, the VibraSlim. And then you can use free weights such as the Bowflex adjustable free weights, either the ones that go to 50 or 100 pounds in each hand. And I have both sets, so I can actually use, one of my favorites is to use 30 to 50 pound weights and do various exercises and do resistance bands. You can do full squats, all kinds of things, and the G-force is 3.6 times at 50 hertz, 3.6 times its current weight for any weight or exercise you do, so you decrease the chances of injury and you increase the chances of full recruitment of your slow and fast twitch fibers, your muscles, hormone release of endorphins, and change your set point. And in the last segment I talked about ALLIMAX, how it is a special allicin, a sulfhydryl group that crosses the cross-links of the viral capsid walls, cell walls of bacteria, mycobacteria, and parasites, so it's universal anti-pathogenic. Kills all pathogens. ALLIMAX and ALLIMED are pretty amazing, and they've got a proven track record. It's given by prescription, actually, in Britain, Europe, Australia, and New Zealand. And that's kind of amazing. And it's been around for like 20 years. Peter Jostyn's research using a potato starch stabilizer to enzymatically stabilize the enzyme so that the allicin doesn't disappear or get destroyed. So they enzymatically create allicins using an enzyme called allinase, and they stabilize with potato starch so it doesn't disappear or get destroyed or cross-linked. A lot of testimonials. People take this, they don't get colds, flu, they reverse joint inflammations, they reverse the inflammation of their brain, they reverse sinus infections because they're knocking out the sinus. And we have people that take it orally and they say, my gosh, my toenail fungus has disappeared, which they've had from Western boots for years. And they said, how's that possible? I said, well, it's going to go through your bloodstream and kill off the fungus on site. So, yeah, you want to sterilize your boots properly, with, say, a woods lamp or ultraviolet light and antipathogenics. But the fact is that you can knock out the fungus by taking it orally from the inside out. That's pretty neat, isn't it?
It is pretty neat. To knock all those out, like you were saying, Dr. Bill. the allicin product is really, different in the sense that it's not a standard, garlic capsule that you're going to find sitting on the shelf, something like Kyolic. It's, the stabilized allicin, as you just mentioned. And the allicin is the antimicrobial part of the garlic that's, the important part that you need to get rid of, these conditions and funguses and things like that. So you got to be careful and do your research and, make sure that you're buying something that works. A lot of people buy, individual supplements or garlic tablets or capsules or something on, that they see, but those don't have much, many medicinal properties there necessarily for you. So if you're spending the money, you might as well get something, that is going to not just make you stink, but also make you stay a little bit healthy.
Yeah, that's a pretty funny way you put that. And the other thing, by the way, as an interesting side effect from taking ALLIMAX ALLIMED is you won't smell, but bugs can smell the sulfhydryl groups coming off you, and you don't get bitten by mosquitoes or ticks if you're actually taking ALLIMAX or ALLIMED. It's kind of a great side effect. So if you're in a place like in the central United States where there's a lot of ticks, say in Ohio or other states in the Midwest where there's a lot of ticks, or in the Northeast, let's say, where Lyme disease or Lyme-like parasites like babesiosis, you protect yourself from all these pathogens, not only primarily because they won't bite and get a blood meal, or number two, if they try to take a blood meal, they'll say, oh, there's something bad in this drink. I don't think I'll drink the blood from this person. So it actually protects you because it repels biting insects. Kind of interesting, isn't it?
I think it is kind of interesting, yes. We've done a study with allicin and Lyme disease, and, Lyme disease is a growing problem in the U.S., but, you can't help being prevented necessarily by a tick, but you could take some allicin and, that may stop them from coming anywhere near you. But if you do, get, bit by a tick, then I would say it's a good idea to, start taking some ALLIMAX right away. ALLIMED, get it into your system. More importantly, though, like I just said, it's something to take on a daily basis and to have for prevention and for maintenance. We have a couple different forms of the product. We have, liquids and creams and, the two different strengths. I know I keep saying ALLIMAX and ALLIMED. The ALLIMAX product is the original strength formula. It's a 180 milligram capsule, and it's 30 pills. And then we have the ALLIMED, which is, the stronger formula. It's a bigger bottle size. It's 60 pills. It's, 450 milligrams, and this is really the heavy duty. So, even if you don't want to take, and then with the liquids, the liquids are really cool because, you can give them to, it's in a water base. It's not an oil base, which a lot of people, think is pretty neat because you can do a lot of things with it. You can give it, to your pets. You can give it to your children. You can mix it, and make, a tincture, for something else if you needed to, for like a wart or something on your foot. You can also, drop it directly underneath the tongue, but, into, nebulizing for if you need to do that for, sinuses. And so there's many, many, many uses of, the products. For those, who can't swallow pills and don't like the taste of the liquid, you could also open the pills and mix them with some sort of food. So the uses are endless, but the ALLIMAX is the, original strength. It's, the less powerful one. And then the ALLIMED is the more potent, more powerful one. So either of them are fine to take on it.
Yeah, let's go through some of the applications. If you start taking it, people have, say, pityriasis ovale, which can actually cause them to go bald because it's a form of folliculitis and due to fungi. And the folliculitis can cause the senescence of your hair follicles. So if you take ALLIMAX, all of a sudden people say, hey, my hair's growing back. I can't believe it. Or they've got NECA, which is cavitations around their teeth, and they've got periodontal disease and cavitations. Osteomyelitis of the bone. Somebody's got osteomyelitis of their jaw joint. Problems with calcified arteries. If you actually start taking ALLIMAX, ALLIMED, you can actually reduce joint inflammation, but also inflammation in your blood vessel walls. ALLIMAX is pretty amazing in terms of getting rid of stealth pathogens like grumbly appendix or diverticuli, which is the left side of the colon. If a person's previously set out the times that they've had diarrhea. They know that they have a very high risk of getting diverticular disease, of chronic obstructive lung disease, of sinus infections, tonsillar cryptitis, and so on. And when we start taking ALLIMAX, all those things just go away. So we also see people's joint inflammation much better. One of the things we discovered years ago is ALLIMAX will also protect your body's compartments like your eyes, because it goes through biofilm. There's often infection in the canals of Schlemm with mycobacteria and stealth pathogens that cause inflammation of the circulation of the hyaluronic acid polymer that carries oxygen and nutrients inside the eyeball. And though taking ALLIMAX reduces not only joint inflammation, but it reduces inflammation in your brain and your eyes and elsewhere, your ears, middle ear, etc. So it's pretty amazing stuff. And I tell people, if you give it to your pets and they've got parvovirus, B19, you want to stop heartworm and so on, it's much better than a whole bunch of stacked vaccines. And just give your dog every day some ALLIMAX too, doesn't it? So
and you can also, you can take it for seasonal allergies. It's coming into springtime now, and that's kind of the season that we're at. So, that's another option. There's so many things that you can do with these products that it's just, it's a miracle. I don't know why you wouldn't want to take some for yourself every day and, basically keep yourself
especially if you
healthy.
travel or you're working with the public, or you could be in an exposed area. Let's say you go on a cruise. I tell people, if you're going on a cruise ship, make sure that you take your anti-Norwalk virus therapy, your ALLIMAX, ALLIMED with you, and take probiotics like Living Probiotic Ultra, so you want to recolonize your gut after you knock off the pathogens. And your trip won't be ruined, so you won't pick up some of these either bacterial or other parasitic diarrhea-creating illnesses. It's amazing how often people get poisoned with our food because the food is contaminated, it's not properly stored or properly cooked, and as a result, the average person gets half a dozen bouts of infective food poisoning every year in America, half a dozen on average.
Yeah, people probably don't even realize that, but ALLIMAX and ALLIMED will help, knock that out right away.
They know something is really messed up when they run to the bathroom every half hour with explosive, watery diarrhea. But they may not connect it. If they were to take ALLIMAX before they travel or after, they would. It'll clean it up quickly, and you'll go back to normal bowel movements.
Got yours today from Dr. Deagle.
Take care. Back in a minute. Are you there?
I are.
Good. Tell us about the chemistry of what makes Silver 100 so unique. People should be aware that there is no comparison to Oxy-Silver or Silver or whatever, Whiz-Bang. All these other things are marketing I call scamtastic. They are scams and they are fantastic, but they are not equivalent to the hundreds of times stronger citrate form of ionic silver that will cross the blood-brain barrier, cross the gut splanchnic circulation, neutralize pathogens, and stimulate stem cells to heal your body. It's just amazing what Silver 100 will do with tiny dosages. It's part of our eye protocol. It's part of our scalp protocol to clear and reverse burns. It's part of our protocol for stimulating stem cells to heal and restore the gut. It's just amazing what it'll do, isn't it?
Well, I don't claim any medical benefits because I just sell a dietary supplement with minerals in it. And this is the amazing thing, is nature is the amazing thing, because all we're doing is giving the body the silver that's been depleted from the American diet over the past 100 years. Has been more than 85% depleted, according to the most recent research that we've seen because of modern agriculture. But we're talking about something that is so completely friendly to the body, but only in the ionic state. And what people are given a lot of strange information in the marketing of colloidal silver products, because they're all making antiquated chemistry where they're just deteriorating a piece of metal in water and creating little tiny pieces that have rust or oxidation on the surface with a tiny amount of bioactive ions. And every bit of modern chemistry now knows the only form of any mineral that can biologically interact with the body in an organic way is ionic form. And silver in the ionic form is incredibly bioactive, but it's incredibly unstable. So what we do is we provide with Silver 100, all the silver in the bottle is in the ionic form, and it has this imperative time release by combining it with citrate and potassium, which sounds very simple, but it's only the result of 10 years and $1 million of research and development.
Right.
To give it the right balance between being stable, it's actually in the solid form in the bottle, and it becomes liquefied or actually dissolved in solution or soluble in the blood and in the body, in the water of the body, when it's exposed to the body's chemistry. And the reason that's so vital and so powerful is because without that, one of two things happens with every other silver product you buy. Either it doesn't have any ions or a tiny bit, and they're in a form that'll never get released in the body, or it's all ions, and it's just silver nitrate powder and water, and there's no delivery, and the silver ions immediately will get neutralized by chlorides in the gut by simply bonding up and forming silver chloride. So silver 100, there's a reason the chemistry professors at University of Miami, Florida Atlantic University, and so on have called it light years ahead of anything else in the field. One has stated that it is between a few hundred and a few thousand times more efficient, drop per drop, dollar per dollar, microgram of silver to microgram of silver than any other silver product on the market. Meaning, you would have to use between 100 and 1,000 times the volume, the quantity of any other product to get the same amount of bioactive component delivered in an active, functional way in the body as you do with silver 100. That's why it's infinitely more powerful, infinitely more economical, and infinitely safer, because you use tiny, tiny amounts to get the same thing, the same results that you would have to, you literally would have to take. There's a reason these other companies make quart-sized bottles and gallon-sized bottles, and the only way you buy silver 100 is in a 2-ounce bottle.
Yeah, I know. It's amazing. The 2-ounce bottle, which I have them sitting around my desk, and I like the 3 different formats: the dropper, the vertical nasal spray for the nose, and the regular spray, and literally can turn off, let's say, eye inflammation, infection, because it's often present in either wet or dry macular changes or anterior Schlem canal inflammation causing glaucoma. People should be aware sinus infections are almost always I call pathogen soup. In the lungs, even rhinovirus subclass 3, we know we can turn off leukotriene D4 and B4, so people, they start taking silver 100 spray and they don't need a rescue inhaler anymore. We have it for people with chronic dysbiosis of their gut. They use silver 100, recolonize with the Living Probiotic Ultra, and their gut dysbiosis goes away. It's really good stuff. I mean, I tell people, one of the last things I do every night when I put my daughter to bed is I give her sprays of silver 100, and I put her special cream on her face, and then I give her a kiss and hug good night. And so every night, Daddy could give me my silver, and she knows if she's traveling. For example, she just recently traveled with my wife and her tutor and her little girlfriend to Las Vegas to see a big play there about the Beatles. And of course, they came back with irritated throats from traveling. As soon as they apply the silver, literally within hours, it's gone. You'll see people, they start to say, I'm starting to get diarrhea from whatever, I'm starting to get a sore throat. They use the silver, and literally not days later, but hours later, they're recovering. And that's how fast it works. It's just mind-bogglingly quick.
Yeah, most people that I've seen over the years that have become familiar with using the silver 100 will not go in a crowd without it, will not get on a plane without it, will not travel without it, but they use it preventatively before being exposed. In fact, that's the ideal scenario. And then the flip side of that, this is why having the dropper, the spray, and the vertical spray on hand at all times is so advisable, because most people, once they are experienced with it, at the very first sign of symptoms, they will use those various dispensers and get it in the body through the various channels the way that you know to recommend it if they want to call you. And 9 times out of 10, within minutes or an hour or two, they forget to use it anymore because the situation is gone and they're back on conducting their lives. I mean, this is a really remarkable product. There's a reason that the head of technology for Morgan Stanley Investing, who created Microsoft, Dell, AOL, and Amazon, said this product may lead to a billion-dollar company and make history changing the world of antibiotics, both from a financial point of view and a humanitarian point of view.
Well, I think that they should have a little sprayer. This is just an innovation idea, I thought, that you should have a little timer sprayer. You know how they have the little sprayers that are running on a little battery in laboratories to try to reduce, to improve the smell inside there. Why don't they have a little Silver 100 sprayer that would go in a laboratory or an airport or a restaurant or a building, so that it would produce an aerosol that would reduce the pathogens on contact surfaces, whether it's sinks or doorknobs and other things, because aircraft should be sprayed. They should be spraying down the seat cushions and other things in an aircraft, because if the last person carried a pathogen from a third world country, just simply doing that, or even having Silver 100 spray in the air conditioning chambers or plenum chambers of air conditioners and buildings, would make it a safe building.
You bring up a very interesting point, which is, I have access to the Silver 100. I have a contact, being CEO and, founder of the company. And I use it every morning when I get out of the shower. Instead of some kind of chemical underarm deodorant, I just spray the Silver 100, and I'm good for the day. And if anybody ever wants to see firsthand how powerful the Silver 100 is at killing bacteria, anytime they notice that they have underarm odor, spray it under there, and it's gone instantly. And it's not because it's masking anything, it's because it kills the bacteria that causes the odor, just like you were suggesting in some of these applications. And, of course, that's just one example of the hundreds of ways that the Silver 100 is beneficial to the body. While it's doing what it's doing, it's beneficial beyond any possible, helping the body fight any kind of pathogens, because it's not only completely non-toxic, not only doesn't create the resistant supergerms like antibiotics do, but it's healing tissue, creating differentiated stem cells, growing back tissue. You put it on a cut, a burn, a bug bite, a mosquito bite, a red ant bite, anything that traumatizes the skin, and it will grow back and heal back to restore to normal tissue, almost like you were watching a science fiction movie, and it's hard to believe it can happen that fast.
It does. It really works that quickly. As I say, I honestly think every burn unit should, instead of using sulfur sulfadiazine, they should be using Silver 100 spray on all the burn patients, and literally keeping them slathered or sprayed with it, just like you walk into the grocery store and all the produce is sprayed every so many minutes with water to keep it moist. All of the burn patients, they should be spraying down every hour or two with Silver 100, and they heal far faster. Amazing, hey?
Yes.
New ideas all the time. As I say, think out of the box. I'm a box agnostic. How's that? Thank you, Jay. Amazing information. Stay right there. We'll get you rebooked. And back in a minute with hour number 3 coming up in just a few minutes with Tim Alexander.